Welcome to this Aspiring Medics tutorial on medical ethics. My name's Luke, and in this session, we're going to be looking at verbal abuse. So we're going to start by looking at verbal abuse in a medical context, then some ethical associations of verbal abuse, then some tips and tricks on how to tackle a question on verbal abuse, and finally, we're going to look through a mock question together. So the definition of verbal abuse. So it's a form of emotional abuse consisting of the use of abusive and demeaning language. And in terms of when you would encounter this, either as a medical student or a doctor, or you could witness it happening to a colleague or a patient. And it can be a very, very stressful situation for medical students and doctors alike. But it is very, very important that you deal with this situation because it can not only compromise your own well-being, but also the well-being of patients. In terms of some of the ethical implications, we can look at it in terms of non-maleficence. So you need to prevent harm coming to the patient through being uncomfortable around them, but you also have to protect yourself against your own harm. So say, for example, if a patient has verbally abused you and you know that you will not be comfortable in carrying on interactions with them, you need to identify this and report this. This is completely okay, but you need to ensure that this patient is not treated unfairly because of the verbal abuse that they have given you. And if you think that the best way to ensure this is through them being treated by another doctor, then it's this might be the avenue to pursue. In terms of beneficence, you want to do good for the patient that's put their trust in you, but you also need to be good by do good by yourself and protect them. And again, that's coming back to, if you feel as if you are unable to sort of justifiably sort of treat the patient, if you've received verbal abuse from them, you need to also recognize this. And in terms of justice, we need to treat everyone as equals within NHS services, and that's including individuals who've been verbally abusive. So we've looked at verbal abuse in a medical context, and we've looked at some of the ethical associations of verbal abuse. So now we're going to look at some tips and tricks on how to tackle a question of verbal abuse. So we're coming back to this spikes framework, and we've been through this a few times now, so I'm going to rattle through it. But again, previous videos will go into it in a bit more depth if you need this. So S is for setting, P is for perception, I is for invitation, K is for knowledge, E for emotion, and S for summary. So now we're going to look at a practice question on the topic. So a patient that you are treating is clearly frustrated about the increased waiting times because of COVID-19. They begin shouting abusive language at you. How should you approach this situation? So pause the video and have a think about how you'd approach this question. So in terms of using the spike model, beginning with setting, so has the patient calmed down and are you comfortable? You don't want to be having this conversation with the patient when they're still incredibly frustrated. In terms of perception, you could say to the patient, do you think that the language that you used was appropriate? Invitation, are you okay to discuss some of the language that you use, making sure that you and the patient are on the same page and that you are going to be having a conversation with someone who is receptive and engaged in the conversation? Knowledge, so are you aware that what happened there constitutes verbal abuse? Then you could say, your language has really upset me, and this is not appropriate in this context. And in terms of summary and strategy, this really largely depends on what you are comfortable with. So you can maybe recommend being seen by another doctor, or if you feel as if the patient adequately understands their actions and the consequences of their actions, and you are happy to go on treating them, feeling as if their sort of quality of care won't be compromised, then you can carry on in that sense. So now we're going to look at some Aspiring Medics top tips. This is a very personal scenario, and therefore the strategy that you devise will be individual. So, say, for example, if you have dealt with verbal abuse before and you've got tried and tested practices able to deal with this, you can incorporate this. You want to use pillars and frameworks. You want to avoid these in patient encounters. So like we've said, so you want to use it to think about the ethical implications of verbal abuse and why you need to act on it. But you want to avoid this in patient encounters because this would constitute medical jargon and this perhaps isn't appropriate. Remember that patient care is a priority. So it is okay to acknowledge that because of this verbal abuse, you do not believe you will be able to offer adequate patient care, but you need to recognize this and report it and act on it, and that's your duty. So we've looked at verbal abuse in a medical context. We've looked at some of the ethical associations of verbal abuse. We looked at some tips and tricks on how to tackle a question on verbal abuse, and we've looked at a mock question on the topic. So you should now be well prepared to answer any question on verbal abuse in your medical school interviews.
To unlock the rest of the videos in this category, make sure to purchase the Aspiring Medics online interview course. We have over 50 videos covering 7 categories, including COVID-19, the NHS, and medical ethics. Head on over to www.theaspiringmedics.co.uk today to ace your med school interview.